Yes. Hi everyone. Hi. Hello everyone. Say hi in the group. Say hi. Hello in the chat box. Mohammed Yunus. Okay. How was your paper one? How was your anatomy paper one? All of you guys. Danish, Shashank Pujar, Kit John. Paper one. Easy, difficult, moderate. Any opinion from your side? Any feedback from your side? Anatomy one. I think RS5, RS6. It was bit difficult. RS5 and 6. RS7, I think moderate to easy. Moderate to easy. Right? Shashank, paper 1. Dhanush Kyar. So let's wait for 1 or 2 minutes. Then we will start, okay? Yes, अच्छा था सर, थोड़ा मुश्किल था. So, okay, Shashank. Time insufficient, sir. Girish GT is telling time insufficient. So, ಎಷ್ಟು ಟೈಮ್ ಕಡಿಮೆ ಆಯ್ತು ನಿಮಗೆ ಗಿರೀಶ್? ಎಷ್ಟು ಟೈಮ್ ಕಡಿಮೆ ಆಯಿತು? ಸೊ ಯಾವ್ದಾದ್ರು ಕ್ವಶನ್ ಬಿಟ್ಟು ಬಂದಿದ್ದೀರಾ ಎಕ್ಸಾಮಲ್ಲಿ? ಲಿಖಿತ್ ಐ ಅಟೆಂಪ್ಟೆಡ್ ಆಲ್. ಓಕೆ. ಲಿಖಿತ್ ಗುಡ್. ಲಿಖಿತ್ ಬಾಲಕೃಷ್ಣ. ಗ್ರೇಟ್. ಓಕೆ. Dhanush, lengthy. Paper was lengthy. Yeah, because 11 short essays. So definitely it is lengthy only. Lengthy. The time consuming paper. Okay. Time consuming. Sir, one question, two answer, L3, L4, L4, L5. Okay. I think lumbar puncture, right? Lumbar puncture. That is L3, L4. I think a few repeats from our classes, right? Inferior colliculus was repeat from yesterday's class. If yesterday's class. Yesterday's class, inferior colliculus. Shoulder joint, main question. The repeat from the class. Flexion, extension, all this we discussed. Right? So many repeats. Yes, Mohammed Yunus Beg. Okay. Chalo. So let's start in 1 or 2 minutes. Sir, in Vishram Singh, BDC, lumbar puncture, L3, L4, L4, L5, R L4, L5. Well, Grace, okay. So you are writing supplementary exam. Mohammed Yunus Beg is writing supplementary exam, okay. It's basically L3, L4. So the answer is L3, L4. L3, L4 is a better answer than L4, L5. Okay, so the answer is you want me to discuss the answers of the paper 1, anatomy 1? You want me to discuss? Or shall I go ahead with the paper 2? Okay. Yes, okay. Varsha Patil, okay, fine. Hello, don't worry about now paper 1. So now it is time to concentrate on paper 2. It is a time to concentrate on paper 2. Don't stress. So as usual lines from my class, don't stress. Don't take any stress of anatomy 1. Whatever happened, happened. Past is past. Do your best again. Now again the same line. Do your best. Today up to 2 or 3 o'clock and tomorrow full day. Do your best. Forget the rest. Don't worry about the anatomy 1. Don't worry about physiology 2 and biochemistry and all now. Now only the anatomy 2. That is the goal right now. Okay. Yes. Okay. That's why we'll have separate discussion after the exam. So time being, we'll start with the paper 2. Yes, Danush. Danush, Sinchit Hale. Sinchit Hale. Okay. So yes, fine. Sinchit Hale. Hi. Okay, fine. So let's start with the paper 2. So paper 2 here, this is the distribution of topics. Distribution of topics. This is RS7, guys. Okay. RS7 pattern. RS7 pattern. Okay. RS7 given by RGUHS. Systemic histology. Systemic histology 11 mark. 11 mark systemic histology. Let's see some important questions which are frequently asked in RGUHS. Okay. Now let's see systemic histology. What are important questions? One favorite question, one important question very commonly asked is the vas deferens and epididymis and ureter. Okay. So after the class, just go through this. Vas deferens, then epididymis, and ureter. Very frequently asked. Frequently asked in the exam. Sometimes the question can be asked about kidney as well. Kidney, it's very simple. Kidney. Okay. Gallbladder. Okay. Remember gallbladder and urinary bladder. So the commonly asked questions, there are 2. Gallbladder and urinary bladder. Okay. Urinary bladder. So commonly asked. I'll repeat again. So systemic histology, there are a few important questions. One is gallbladder, urinary bladder, the kidney, vas deferens, epididymis and ureter. So just go through these topics. The stomach though definitely will write. Simple columnar epithelium, all mucosa, submucosa, muscularis, adventitia and all. Duodenum you will definitely write Brunner gland and so, and Peyer's patches, that is ileum, very commonly asked. Okay, all these are important questions. Yes, Mohammed. Welcome. Now comes the systemic embryology. Systemic embryology. In systemic embryology, one important question is midgut rotation. Midgut rotation. Midgut rotation. Okay. Midgut rotation very commonly asked. Mal rotation. What are the applied aspects of midgut rotation? So 90-degree rotation, 180-degree, total 270-degree rotation. So that is very, very important topic. Then second important topic commonly asked is the development of pancreas. Development of pancreas. Development of pancreas. Dorsal pancreatic bud, ventral pancreatic bud, and the derivatives. Commonly asked. Then comes is development of kidney. Development of kidney. Metanephros, mesonephros, pronephros and all. Development of testes and descent of testis. Very important. Testis. testis. I'll repeat again the important questions: midgut rotation, development of pancreas, development of kidney and testes, and one more very important topic. One more very important topic: paramesonephric duct and mesonephric duct. Two important topics. So paramesonephric duct and mesonephric duct. So all of you just type in the chat box paramesonephric duct and mesonephric duct. Mesonephric duct, very commonly asked. Derivatives of mesonephric duct. All of you just write in the chat box paramesonephric and mesonephric duct. Usual 3 marks question in RS 5 and 6. It can be a reasoning question or it can be a short essay in your RS 7. Yes, right. Virsang. No, Virsang basically duct of pancreas beta. My question is about the embryology. So derivatives of paramesonephric and mesonephric, males and females, frequently asked. So these are important question. Nazba Tanya, after the class, just go through these derivatives, paramesonephric and mesonephric. Mesonephric known as Ufian duct. So there are derivatives, the mnemonic is seed, seminal vesicle, epididymis and all. Okay. Yes, Sayan Mondal. Okay, that's great. Chalo. Next comes is genetics. In genetics, there are 4 important questions. All of you, there are 4 important questions. One is Down syndrome. Down syndrome. The second one, Turner syndrome. Turner. Klinefelter syndrome. Klinefelter syndrome. Down. So ಒಂದು ವರ್ಷ ಡೌನ್ ಕೇಳ್ತಾರೆ. ಅದಕ್ಕೂ ನೆಕ್ಸ್ಟ್ ವರ್ಷ ಟರ್ನರ್ ವರ್ಸಸ್ ಕ್ಲೈನ್ಫೆಲ್ಟರ್ ವರ್ಸಸ್ ಡೌನ್ ಸಿಂಡ್ರೋಮ್ ಕೇಳ್ತಾರೆ usually. In recent, one of the exam question asked about Denver classification. Okay, Denver classification. Denver classification. What is karyotyping and discuss in detail about Denver classification. Okay, so all of you just write in the chat box. Pradeep and Charan, everyone please write down, Turner, Klinefelter and Denver. Denver, down, Klinefelter and Turner. Write this in the chat box, all of you. After the class, just go through this important topic, very important, very scoring. Okay, this is about the genetics. Now the lower limb. Let's see about the lower limb. Lower limb. Keep writing. Few points, all of you. Keep writing. Keep writing, guys. Keep writing. Down, Turner, Klinefelter, Denver. So and Wendell. Frequently asked. आगे देखते हैं lower limb. Lower limb. See, in lower limb, hip joint. Hip joint very important. Articular surfaces, type of joint, ligaments, movements, muscle causing it, and applied anatomy. In applied anatomy, you must mention dislocation of the hip, congenital dislocation of hip, acquired dislocation of hip, and the fracture neck of femur also you can mention. You can mention about avascular necrosis of femur as well. So hip joint is very important in lower limb. Hip joint आपको पढ़ना ही पड़ेगा. Hip joint. Then one difficult question that can be asked in your exam from the lower limb: arches of foot. Arches of foot. Arches of foot. So this can be difficult question, guys. Arches of foot. Transverse arches and longitudinal arches. Very commonly asked. Can anyone answer what is pes planus? What is pes planus? What is pes planus? Yes, come on, guys. What is pes planus? Pes planus. Frequently asked. Let's make it interactive, guys. Nazba, don't worry. Hip joint is asked twice. Hip joint. Knee joint Knee joint, yeah. Malini answered, sir. Pes planus is flat foot, and pes cavus is the high arched foot, and CT. Okay. Okay. So good. Fine. Fine. Flat foot. Very good. Mohammed. Very good. Sayan. Very good. Charan. Very good. Shashank Pujar. Flat foot. Pes cavus. Okay. Then comes is your knee joint ligaments. Knee joint ligaments. Very important. Knee joint ligaments. Cruciate ligaments. Very commonly asked. Cruciate ligaments, intracapsular, extracapsular ligament, in that cruciate ligament, very commonly asked. Okay, knee joint. Ankle joint, okay. So it's rarely asked, but they can ask anything. So, but arches of foot, very very important. Saphenous vein, great saphenous vein. All of you, very important. Great saphenous vein. Short saphenous vein or small saphenous vein, which is used in venesection, also used in coronary artery bypass surgery, very commonly asked. Great saphenous vein, frequently asked. Okay, so this is about the lower limb. Now let's discuss ATCAM question. So already we discussed ATCAM around 5 mark. You can see there ATCAM is 5 mark. So in ATCAM classes I discussed cadaver is the first teacher. Explain, that question came in today's exam, right? Cadaver is the first teacher, and there are 9 more questions are there. Definitely there will be one question from ATCAM. Go through the other 9 ATCAM question from the previous live lecture. Okay, so ATCAM 5 mark. Then pelvis 20. Pelvis 20. Pelvis. So pelvis is it's scoring actually. It's a short chapter, a small chapter. We can read in 1 or 2 hours. Okay, pelvis you can complete early. Then abdomen, that is 28. So abdomen and pelvis around 48 mark. Then lower limb, that is 17. Genetics, that is 8. Genetics, that is 8. So this is about the anatomy paper 2, the distribution of topics. Distribution of topics. Yes, guys. So I think now it is the right time to start pelvis. So complete the pelvis in 1 or 2 hours. Then you can start lower limb, that is 1 hour. Then you can start a few outcome topics. Then abdomen, like that you can plan. So this is okay, fine. Any doubt in this? Karan, Malini, any doubt? Any doubt in this? Any doubt you can ask me. So many question came in anatomy 1. I'm very happy about it. I'm very happy for you. So inferior calculus came. Okay. Outcome question came, one question, 10 mark. Then shoulder joint that came, 10 mark, that is 20. So even median cubital vein. There are many MCQs from our classes. Many MCQs. Hmm? Yes, Nazba, yes. Yes, a pelvis. Pelvis, okay. Let's discuss about pelvis as well. Chalo. Now, my prediction probably. So one question to very commonly asked. Before that, vast difference. Okay, that's fine. Chalo. One very commonly asked question is inguinal canal. Yes, oculomotor now. Malini, yes, Malini, oculomotor now that came. Lumbar puncture. Okay, lumbar puncture. So many question came in the class. Charcot's artery. Yeah, question came for Charcot's artery. Charcot artery basically what? That is the middle cerebral artery. Lenticulostrial branches of middle cerebral artery, which are very commonly involved in stroke. Circle of Willis. Circle of Willis basically. Yes, good, good. Chalo. Okay, this is one important question, guys. Inguinal canal. आपको पढ़ना ही पड़ेगा. So ಇವಾಗಲೇ ನೋಡ್ಕೋಬೇಕು inguinal canal ನೋಡ್ಕೊಳ್ಳಿ. ಏನು ನೋಡ್ಕೋಬೇಕಂದ್ರೆ location extends. So location, length, all you know, length is 4 centimeter. Location, you know, boundaries. Okay, roof, floor, anterior, posterior, and all. Contents, spermatid cord and round ligament, that is in females. And protective mechanism. Can anyone answer what are protective mechanism? This is a bit difficult. What are protective mechanism? Can anyone tell me 1 or 2 protective mechanism? Yes, come on guys, 1 or 2. Let's see. Our offline students, are you there? What are important protective mechanisms? Come on, guys. Come on, you need to answer. Need to answer, guys. Ball valve mechanism. Very good. I think Malini answers are ball valve. Ball valve. Okay. One is ball. Ball mechanism. एक हो गया. Shutter mechanism. Very good. Inner shutter and outer shutter mechanism. Okay. Shutter mechanism. Okay. Shutter. Okay. Ball valve. Then flap valve. Okay. That is also okay. Ball valve. Okay. Flap valve. One more is there. Shashank, do you remember? Key shutter mechanism. Very good. Key shutter mechanism. Key shutter mechanism. Key shutter mechanism. Shutter mechanism. Adarsh Kumar Belloor. Very good. Okay. Key shutter. Very good. So this is one. And applied anatomy. Applied anatomy. You must write. You must write applied anatomy in exam. Okay. So because RS7, so आपको hernia लिखना ही पड़ेगा. hernia आपको लिखना है. क्या लिखना है आपको? hernia लिखना है. What are two types of hernia? Hernia, direct hernia, indirect hernia. Which is the commonest hernia? Can anyone answer? Hernia I said. So hernia, which is the commonest hernia? Is it direct, indirect? Direct or indirect? So direct andre through the posterior wall ಇಂದ ಬರುತ್ತೆ. Indirect andre deep inguinal ring, superficial inguinal ring, then into the scrotum. My question, which is commonest one? Direct or indirect in young people, in young adults or adults basically? Can anyone tell me inguinal hernia, which is the commonest one? Indirect. Very good, Malini. Excellent, Malini. So Malini said, sir, in adults, it is basically indirect. In old age, it is basically direct hernia. Direct hernia. So this we have to mention. The difference between direct and indirect. The commonest one is indirect. The commonest in young adults is indirect. Indirect commonly goes through deep and superficial and to the scrotum. Direct through the posterior abdominal wall. Then the direct is common in old age. So 2-3 points you can mention. Examiner will be very happy. Okay. Yes, good answer. Indirect, good. Chalo, ye ho gaya. Now there is one important mnemonic. Mnemonic you don't try to remember, and this is important diagram, guys. This is very important diagram. This you need to write in the exam for sure. Okay. Now mnemonic is inguinal hernia. There are two types, direct, indirect I said. The mnemonic is MD don't lie. MD don't lie. So that is MDLI, basically MDLI. MDLI. So the medial to inferior epigastric vessel. So when hernia is medial to inferior epigastric vessel, that is direct inguinal hernia. Lateral to inferior epigastric vessel, that is indirect inguinal hernia. So this is important mnemonic. So I'll write in the chat box MDLI. MDLI. Medial is direct, lateral is indirect. MDLI. MD don't lie. Okay, write this in chat box, Charan. So this can be an MCQ as well. Which of the following hernia is medial to inferior epigastric vessel, Hasselbalch triangle, and all very commonly asked in the exam. Okay, ठीक है, चलो. MDLI, all of you write MDLI. So this is one important question, inguinal canal. Then important question, all of you guys concentrate, uterus. Okay, so the question can be asked, position, normal axis of the uterus. Parts, simple, fundus, body, isthmus, cervix. Gross anatomy, peritoneal reflections, what are the pouches, what is the peritoneal pouches. Then you can write relations, so what are anterelations, what are posterior relation, what are like that you can write in the exam. Okay, so peritoneal fold, blood supply, uterine artery relationship with the ureter, very important. Then development very important, and applied anatomy. Can anyone tell me what is normal position of uterus? Normal position of uterus. Normal position of uterus. Can anyone tell me? Second question, all of you guys concentrate. Uterus. Pakka question. Inguinal canal. Pakka question. Arches of foot. Pakka. 5 marks. Pakka question. Okay? Yes. What is normal position of uterus? I need one word answer. One word answer for normal position. Normal position of uterus. Like this, hai na? Like this. Like this. What is that known as? Yes, come on, guys. Anti-flexion, anti-version. Very good. Some student answered, sir, it is anti-version and anti-flexion. You can see that this image anti-verted. So anti-version, that is 90-degree, and anti-flexion, that is 125. Anti-version, anti-flexion, anti-version, anti-flexion. Anti-version is 90, anti-flexion is 125. So write this in chat box. Anti-version 90, anti-flexion hai wo, that is 125. All of you write this in chat box. So write this in chat box. Anti-version, anti-flexion. Okay, this is important question. Milan R 125, 120. That's okay, right? Now in uterus, you must write about supports of uterus. Supports of uterus. Very commonly asked. Supports. Supports of uterus. Very, very important. Very, very important. So supports are basically primary support and secondary support. And secondary support. And also in exam, you can write about broad ligament. If you have time, you can write about broad ligament. Broad ligament. Broad ligament also important question. Okay. Yes. Antiversion and anti-flexion. Cyan bundle. Good. So 120 and 125. That's okay. That's fine. Hernias. That's fine. Okay. Then applied anatomy. A clinical aspect. Uterine prolapse. Uterine prolapse. So uterine prolapse. The prolapse of uterus through the vagina. So then the one more is uterine cancer. Then that is infections, and also uterine myoma and all you can write. So you can write about uterine prolapse, very commonly asked in the exam. Okay, so because of the weakening of the McInroy's ligament. Now, so this is very important diagram you need to practice. So now after the class, just practice this diagram, big diagram, label diagram in your exam you need to write. Fundus, uterine cavity, and all this you need to label properly. Okay, and also you must write about fallopian tube. So what is the length of fallopian tube? All of you, what is length of fallopian tube? What are the parts of the fallopian tube? Very commonly asked. Fallopian tube applied aspect is ectopic pregnancy. So the pregnancy implantation can occur in basically in fallopian tube, that can lead to rupture, that can lead to bleeding and death. Ectopic pregnancy very commonly asked. Then and also one more is that is infections, basically that is infection. That's fine. Okay, chalo. Important. So second question is basically okay. So supports of uterus. Okay. Now what is this condition? What is this condition basically? This is uterine prolapse. Then fallopian tube, very important. There are 4 parts are there: infundibulum, ampulla, isthmus. Ampulla is the site of fertilization. The total length is 12 centimeter. You can write this this image also, broad ligament, ovary and all you can write. Next question, bladder. So all of you concentrate. The next important question is bladder, urinary bladder. So remember urinary bladder. Sometimes the question can be asked gallbladder. So some student know, so they get confusion and they'll write gallbladder instead of urinary bladder. Don't do that. So bladder is there, urinary bladder, gallbladder. So both are different. Okay. So parts of the urinary bladder, trigone of the bladder. So and all apex, base, and all you are going to write. Anti relations, post relations, applied aspects, nerve supply very important. Nerve supply. Okay. So location, relation very important, guys. Venous drainage and applied aspects, urinary bladder. The same gallbladder also, very important question. Gallbladder. What is the most common gallbladder stone? So gallbladder. Also important. Very, very important. What is the most common gallbladder stone? Can anyone answer? Most common gallbladder stone. There is something known as 5F. 5F in relation with the gallbladder. This also you can write when question asked about gallbladder. So when there is a gallbladder stone, you can do cholecystectomy. This is the major operation. The risk factors for gallbladder stone is 5F. 5F. What are 5F? F for 40. 40. It commonly occurs at 40 years of age. Female. Female. Fatty. Fair. Fair. One more F is there. What is one more F? So 40, female, fatty, fair. One more F is there. Fertile. Fertile. So all of you write in the chat box. Gallbladder stones is equal to 5F. And the most common gallbladder stone is cholesterol stone. So cholesterol. So all of you write in the chat box. Charan, yes. Female 40, fair 40, fertile. Okay, good. That's great. So that's great. That's great. All answering. That's great. Charan, excellent answer. Charan, excellent answer. Great. Gallbladder, okay. Done. Now important question is anal canal. Anal canal. Okay. Very important. Okay. Pectinate line. Hilton line. Hilton's law was asked in the paper 1. Hilton's line in paper 2. Hilton's line, pectinate line. Parts of the anal canal. Upper part, middle part and the lower part. Upper zone, middle zone, like that. Internal features, the anal valve, anal columns. Okay. Anal cushions, sphincter, external, internal. Venous drainage, again it depends on the area. Okay. So then applied aspects. Applied aspects you need to write about the hemorrhoids. Hemorrhoids can be a question. Hemorrhoids. Hemorrhoids can be external or it can be internal. Now my question is, which is painful, which is painless? Hemorrhoids, there are two types, external and internal. My question is, which is painful hemorrhoid? Internal hemorrhoid again classified into grade 1, grade 2, grade 3 and grade 4 and all. So hemorrhoid is very common question that is related to anal canal. So the question can be asked about rectum as well. Okay. So rectum is not asked in any of the exam. So only once the question asked about the peritoneal relations of rectum. So they can ask about the rectum in detail in upcoming exam. Just go through this. External is painful, internal is painless. Okay, good. External is painful, internal is painless. Excellent answer, Shashank. Excellent. That's great. So anal canal, rectum. Okay, after the class, just go through rectum. Few points about rectum. Rectum, 5 marks. And difference between duodenum and jejunum. So duodenum versus jejunum. Commonly asked. Ileum. Ileum also very commonly asked. Stomach though definitely very easy. Stomach, the second part of duodenum. Okay, so duodenum is very commonly asked. Okay, okay. Innervation. So innervation though very important. Innervation. Good. Okay, so anal canal, that is done. This is what we discussed. External, internal hemorrhoid. Internal hemorrhoid, that is basically painless. There are different gradings are there. External hemorrhoid, so it is painful. The treatment is hemorrhoidectomy. Hemorrhoidectomy is a treatment. Okay, the other treatments as well. So hemorrhoidectomy is the one treatment option. Okay. Yes. Yes, duodenum relation very commonly asked. Yes, duodenum especially second part, first part very commonly asked. Relations of duodenum. Stomach bed is also asked. Stomach bed. So this is okay. This is question number 4. Okay. So just here, one extra point here. Above pectinate line. So above pectinate line, and below pectinate line. Okay, innervation. So pudendal now below pectinate line. So pudendal now it is below pectinate now, pectinate line, and above pectinate line it is basically inferior hypogastric flexus. So this is very important question. Then comes his rectum. Already I said rectum. So once this question asked rectum, peritoneal relations of rectum, peritoneal relations of rectum. Just go through this. Asked once in the exam, RS4. Arches of foot, very important. Arches of foot, very important. You need to write about the ligaments, muscle, keystone, pes planus, pes cavus and all, and label diagram. Stomach, very commonly asked. Stomach, commonly asked in exam. Okay, commonly asked. What is the common site of ulcer of stomach? What is the common site of gastric ulcer? What is the common site of gastric ulcer? Gastric ulcer. What is the common site of duodenal ulcer? Duodenal ulcer. Can anyone answer? What is the common site of gastric ulcer? What is the common site of duodenal ulcer? So this can be a question in your exam. Antrum. Antrum. Lesser curvature, very good. And lesser curvature in case of good answer, lesser curvature. Lesser curvature. Lesser curvature. So here, duodenum. Which part of duodenum? First part of duodenum. Very good. First part of duodenum. First part of duodenum. First part of duodenum. As you know, there are 4 parts are there. There are 4 parts are there. The first part is commonly affected in duodenal ulcer. So we doctors, we medical students at risk of duodenal ulcer, not the gastric ulcer. It is a part of peptic ulcer disease. The treatment given is proton pump inhibitor, like example, pantoprazole, pan D, pan 40 and all. So that is basically given in case of, in peptic ulcer disease. Then comes is the prostate. So prostate, very important. So prostate can be difficult question, okay? Very important. Not asked. Because prostate carcinoma is the commonest carcinoma in males. Cervical carcinoma common in females. Breast carcinoma common in females, right? Like that, prostate carcinoma common in males. The common site of metastasis is the bone as well as the brain and others, right? So prostate very commonly asked. So you need to write about BPH. BPH. What is BPH? What is BPH? Come on, what is BPH? Can anyone tell me what is BPH? Urgency, frequency. So that is the presentation of BPH. Urgency of urine, nocturnal urine, frequency of urine, incomplete evacuation, 40-50-year-old because of testosterone effect. So what is that? BPH. Benign prostatic hypertrophy. Malini, very good. So benign prostatic hypertrophy and prostatic cancer, both are very commonly asked. Then comes is your pelvic diaphragm. So pelvic diaphragm, all of you concentrate here. This is very important question. In pelvic diaphragm, so what are the muscles forming pelvic diaphragm? What are the openings in pelvic diaphragm? Attachments. And very important is superficial perineal pouch. Okay. So this is very important, guys. All of you just go through. This can be a question. Superficial perineal pouch. Perineal pouch. Deep perineal pouch. Deep perineal pouch. Deep perineal pouch. So both are very important. The boundaries of this pouch and the contents commonly asked. Very commonly asked. So Charan, just write in the chat box. superficial perineal pouch, deep perineal pouch. Pakka question. Just write this in the chat box. So just go through this. Just try to memorize this. It's one of the most difficult to topic to remember. Yes, Girish. Okay, that's fine. So Girish is answering. That's okay. Pancreas. So the next, okay, Levitrani. Okay, Girish PR, very good. Girish, you are answering well. That's great. Pancreas, Paka question. So head, neck, tail, body. Then what are endocrine function, exocrine function? You can write. Then the ducts, duct of Wirsung and duct of Santorini. Very important. The major duct is known as duct of Wirsung. The minor duct is known as duct of Santorini. What are the functions? Hello. Hello. I'm audible now. Now I'm audible. I'm audible now. Hip joint. So the last one is hip joint. So all these are important question commonly asked in the exam. Next, now I have some questions about the genetics. Now, can anyone answer what is this scenario? Now, am I audible? I'm audible now. I'm audible, guys. Yeah, audible. So look at this now. This is very important question. Shashank Pawar can answer this question. This clinical scenario showing clinodactyly, single palmar crease, single palmar crease. So we have two or three creases, right? Single palmar crease, brush field spots, brush field spots, fissure tongue, epicardic fold, 21 trisomy, mental retardation. Very commonly asked. What is this, guys? What is this? Yes, very good. The first answer is by Dora. Dora, excellent answer. Pakka question, all of you. Just remember small ear, upward slanting eyes, upward slanting eyes. Cardiac defects. Cardiac defects are very common in Down syndrome. Trisomy 21. Trisomy 21. Very commonly asked. What is the main risk factor for Down syndrome? Advanced maternal age. Advanced maternal age, very important. Semen increase, very good. So this can be a question. Then, now this question from genetics, again, look at this question. Identify this. Short stature, rippling of neck, broad, widely spaced nipples, broad chest, cubitus valgus, pigmented navy, streak gonads, streak ovaries, infertility, amenorrhea, coagulation of aorta, low posterior hairline. What is this condition? What is this condition, guys? This is not Klinefelter. This is not Klinefelter. Short stature is there, beta. Short stature. Height. Short height. Webbing of neck. Webbing of neck. Pigmented navy. So, peripheral lymphedema. The question can be asked. These points you need to write in the exam. At least 5-6 points. Try to memorize all this. So this is basically 45x0. This is Turner syndrome. Turner syndrome. 45x0. Turner. Okay? Turner can be a question. Then now look at this image. This image. Tall. Less muscular. Broad hips, long legs. Gynecomastia. Gynecomastia is there. Weakness of bones. Less facial and body hair. So what is this now? This is basically 47xxy. 47xxy. What is this condition basically? This is basically Klinefelter syndrome. So, Klinefelter syndrome, 47xxy. Frequently asked in exam. And the last question. So try to memorize this. So this is known as Denver classification. Denver classification frequently asked in the exam. So this is the classification of chromosome. So and karyotyping basically. So group A, B, C, D, E, F, and G, and also the size and relative position of the centromere. This is very, very important. Very, very important. Good. Denver. ठीक है? Denver class. So this completes your session on most commonly asked question. Yes, guys. So study well, work hard. So go through all important questions, go through all notes, previous notes, and revise. Practice some common diagrams like uterus and this perineal pouch and all. So all the best. Let's come up with some more topics tomorrow if possible. I'll let you know. Thank you all. Thank you.